and then he's planning to pursue hematology, oncology, and pediatrics afterward.
Right. Yeah.
Something like that.
I'll tell you all about that.
Okay, cool. We're really excited to have him. Dr. Trask kind of hooked us up with this, with him to come. He's just in town for a week. As you can see, his fellowship, I mean, he's a busy guy, so it's really nice of him to take the time out of his, it's like basically vacation, right, that you're here, taking time to be with us. So give him a hand, and we'll be happy to hear from him. So.
Thanks everybody for having me. It's been several years since I've been to this hall, but it's nice to be back on campus. My name's Chris. I am, I'll tell you a little bit about kind of my path from Weber State to where I'm at currently, and I've served on admission committees at the University of Utah as well as in residency, and now I serve in fellowship, and I'm happy to answer questions and kind of give you some ideas about what folks are looking for as you kind of progress through the next couple of stages. Before I get going, is anyone here, I'm sure you have some seniors here that have applied to medical school. Is anyone here going to medical school this next year? Where are you guys heading to?
Either Indiana or Creighton right now, but I'm waiting for a few.
Great. Yeah, you'll be heading out my way. Where are you heading to?
Indiana or the U waitlisted me, so.
Great.
So I might ask you if I can get off the waitlist, since you know how it works.
Yeah.
University.
Great, congratulations. That's great. Indiana's a great school too. Big hospital. Indianapolis is very similar to Salt Lake as far as the size of it and kind of community. Folks are nice out in the Midwest. So wonderful. All right, so a little bit about where I came from. I graduated from Weber State in 2003, so 11 years ago. I grew up in Roy, went to high school there, then did a mission after that for a couple of years, and then came here. And when I was an undergraduate, I had a lot of fun. It took me 5 years to get through. Usually people take 4 years. It took me 5 years. And it wasn't that I kind of applied for med school and then waited a year. It wasn't that. It was that I kind of wasted my time on taking a bunch of classes that I didn't necessarily need to take. I don't know if you guys have been in that situation, but sometimes you really have to buckle down and figure out your direction early on, or else you just kind of waste your time. And I ended up with way more credits than I needed to. While I was at Weber State, kind of the big thing that I think that when people are looking at medical school applicants, they're looking for something that's a little bit different. And when I was here, in this same room, a guy named John Hanrahan did a presentation about an organization called the Hope Alliance. And the Hope Alliance did a lot of humanitarian and also kind of service projects down in South America and in Africa. And I said, you know what, this is something I want to do. So I went with those guys, went on a trip, and again, this was back in 2000 or 2001, so it was 14 years ago. But I did a trip, and I said, you know, this is something that's really exciting, I'd like to be a part of it, and I came back and it was kind of on fire. I said, we don't have anything like this at Weber State, why don't we set up something? So I got a couple of my buddies roped in together, and we organized a Hope Alliance kind of club here. And then through time, people would go on these expeditions, 10 to 20 people a year would go on these trips down to South America, and I led a couple of them. And one of my other buddies who did dental school led a couple of these trips, and raised a bunch of money and got a bunch of like medical supplies and shipped them down to Peru, and it was a lot of fun, and I learned a lot and grew a lot. At the same time, like most of you guys, I'm sure, I got involved with, and I went and volunteered in the emergency department over at Ogden Regional, and I did that for about 5 hours a week. I worked in one of the labs here, working with Drosophila, so I got a little bit of lab experience. I'm sure there's a lot of, is there a lot of lab experience or opportunities for you guys? Research opportunities? Raise your hand if you have some research experience. So about half of you. Then on top of that, I shadowed a lot. I had some backup. I applied to some DO schools too, so I went to some DO folks throughout the community and some MD folks and got my letters of recommendation, and then studied for the MCAT, right, and got my grades, and then at the same time I was working full-time, so it was pretty busy. And my job, I kind of geared in medicine, and I worked as a respiratory tech and got myself through undergraduate. So I come in the mornings, then to school, work in the afternoons, and then my evenings were studying and volunteering and that kind of stuff, and doing these excursions. When I was on the admission committee at University of Utah, the things that we looked for is kind of a diversified person. Now Utah is a little bit different than other schools. So what they were looking at is 70 different criteria. And this, they might have changed because they've changed deans, but this is what they had at that time. And each of these different criteria weighed equally. So you could have you could say 70 points. And grades were one, and where you went to school. So Weber State, although it's a wonderful place and you get hands-on, and a lot of other schools outside, they think, oh, Weber State's kind of, on the lower end, right, when they're comparing to Ivy Leagues and that kind of thing. And that is what it is. I wouldn't have changed anything, and I'm happy I went here because I got my professors knew me by name. I saw them. My wife, who's a pediatrician, they had no idea who she was. She was in classes of 300 to 400 when she took her organic and inorganics and stuff. The next thing that they looked at was your MCAT scores, and those stupid scores are really important. They really make a difference when you're applying. Then they looked at leadership opportunities. University of Utah, they wanted you to do something on top of, if folks went on a mission, they wanted you to do something on top of that. So it had to be some sort of leadership opportunity. Maybe it's a business, you're a manager, folks at your work, or maybe you were president of a club or some sort of leadership. Volunteer experience. They also looked at your medical experience. And then they also said, have you done anything, what have you done for the community or internationally and that kind of thing. And then finally, your interviews. When they interviewed you, you had two interviews. And if both of them said no, you were out. If one of them said, yeah, I like this guy, and the other one said, no, I don't want this guy, then they give you a third interview. And then you have your third interview. And then that person kind of was the tiebreaker. And then they took these points, right, and said, okay, well, Chris had this and this and this and this, and his point score was 65 and out of 70, and let's accept it, kind of thing. And they have a couple of different layers. They have people that they admitted early, people that they admitted, and then those people found out usually in like December, people in the middle, and then they had waitlisted, and then they had no. And you got to remember, they had, for those 80, 90, 100 spots, they had like 1,000 applicants or something stupid like that. Because everybody from here, and Utah State, and BYU, and Idaho, and Wyoming, and Washington, and all the surrounding states really peg here as a place to go. So that was University of Utah. I went to University of Utah, continued on with the international stuff. I had a lot of fun. And then when I went to, I had been volunteering in the emergency department, and I thought, this is what I want to do. And then when I was at University of Utah, I said, I did my pediatric rotation and it really kind of just fit who I was, and enjoyed working with kids. I enjoyed working with people's families. And so I said, I think I want to do pediatrics. And I had done all this international stuff, and I thought, why not go down to Miami, Florida, and do my residency? And so that's where I did residency. And I met my wife down there, and then after that, I decided hematology-oncology was a good fit. I liked taking care of sick kids, but I liked having continuity. I didn't necessarily like clinic work, but I did like taking care of people that were really sick, and I didn't mind having the conversations like, your kid's going to die, or hey, your kid's got cancer, and that kind of thing, and I felt comfortable with that. And so I did hematology-oncology, and then I'm done here in about 2 months, and I'm staying on as faculty at Cincinnati Children's as a bone marrow transplant physician. So we do about 120 bone marrow transplants a year. Bone marrow transplants are primarily for kids with cancer or immunodeficiencies or genetic disorders, and you just, either radiation, chemotherapy, you ablate their bone marrow, and then you replace it with someone else that's maybe their siblings or maybe an unrelated donor. And it's a great career for me. I'm really happy, and it's a great place. And I feel like I was really fortunate to come from this place. It gave me a good foundation that I've used throughout my life. So you guys are, like I said, you guys are very lucky to be here. When I talked to my wife about her school, she went to University of Michigan, so a big powerhouse. Like I said, I knew all of the faculty. I was very close with all of them. When I was trying to decide what medical school to go to, they sat down with me. Van de Graaff was here. I'm sure you've heard about Dr. Van de Graaff, and he was my advisor. And he really would sit down and just kind of guide me through my application and help me decide what school to go to and such, and he was a great advisor for me. So that's where I'm at now. Like I said, 2-3 months from now, faculty, it's great. I'm happy. It's all about the journey. It's a long, long road, but it's well worth it. And I'm really, it's a great career. So I think the most of you guys are probably thinking, you know, I want to find out more about medicine. I want to find out more about medical school. I've got all the time in the world. When I was in your seats, I love these to ask people questions. So just ask me what you'd like to know, and I'd be happy to fill in any stories I have, and just answer the questions directly as best as I can. Please.
So you went to pediatric residency, right?
Yeah.
And then now you're doing like almost surgery then? I mean, it's a surgical to like do...
No, so it's a little bit different, oddly enough. So our bone marrow is a little bit different than... So let me just back up a little bit. Some of the subspecialties like cardiology, endocrinology, infectious disease, hematology, oncology, you can get to these one of two ways. You go through internal medicine, you do a 3-year internal medicine residency, and then you say, you know what, I want to be a gastroenterologist. You do another 3 years on top of that to subspecialize. And the same thing happens on the pediatric side. You do 3 years of pediatrics and then an additional 3 years after that to kind of subspecialize. When you're subspecializing, you have, it's really divided. So about a 20 to 30% of your time is dedicated towards clinical work, right? So I see patients, or my patients, I take care of them. But then the other 60 to 70% is research. And then that's how you get your faculty appointment. So I'll be a professor or an assistant professor at the University of Cincinnati working inside of the hospital primarily. So the people that I educate and I teach are going to be med students and pre-med students that maybe come through in residence. That will be my education responsibilities. So going back to bone marrow transplant, bone marrow transplant's a little trickier than you think. So when you take a bone marrow, say your brother gets leukemia and it's really bad, it stinks. And we get him cleared, but it's a high-risk leukemia, and you're a perfect match for your brother. So what we would do is we take you to the operating room, we'd suck out some of your bone marrow out of your hip, put you under, suck out some of your bone marrow from your hip, and then we put it in a bag, we freeze it and put it in a bag, and then hang it just like a blood transfusion. Your stem cells are they're smart. And what I tell them, they go back into the marrow, reimplant themselves, and about 2 to 3 weeks later, they're fully functional. Now, those kids are very immunocompromised for the next 6 months because you have to develop your immune system again, just like an infant. And it takes 6 months to a year for them to fully mature, but there's no injecting them back. It's not like a hip transplant. It really is a transfusion. Where the critical care comes from is they're immunodeficient, so all sorts of infections can happen. And chemotherapy and radiation you give them are pretty intense. So usually the patients are inpatient for about 30 days, but you know, there's some transplants have a 70% mortality and some have a 20% mortality. So there's a lot of complications that can happen, and it's a lot of intensive care.
I've heard, kind of going on with that specialty, I've heard that they're coming out with drugs so you don't have to do the hip transplant, you can just give them a drug and it'll release the stem cells. Is that true or not necessarily?
It's a little bit different. So there's a couple of different ways you can harvest. You harvest peripherally, and you can harvest by marrow. So there's 3 ways you can give somebody a bone, like you can give someone stem cells. One is through a cord blood transplant. One is peripheral blood stem cells, so you collect them, you give them that medicine you're talking about, it releases it, and you can pull them out of this periphery. Or you can do it by bone marrow. Bone marrow is still the best as far as when you give it to the next person, it gives them a better chance of not having complications.
Good. So going into medical school, did you already have some kind of an idea of what you were headed towards, or?
No, I didn't. I thought I was going to be emergency medicine, but that was just because of my experience. The only experience I had was in the emergency room, right? I thought, hey, these guys do pretty well for themselves. They work 15 shifts, 12, 15 shifts a month. That's not bad. And that'd be a pretty good gig, so maybe I should do that. But that was the only thing I had experience with. So in medical schools, if you guys don't know, they're broken up into really 2 halves. First half is all clinical, all didactic stuff, sitting in lectures, grinding it out, taking a bunch of tests. And then your third and fourth year is when you're in the hospital, rotating on the different rotations, doing the different rotations, and that's when you do your clinical. That's when you figure out what you want to do. Now, I think there's a little bit of a misunderstanding. I know some of you, when you guys have talked about DO schools, when I was in your spot and people would talk about DO schools, what kind of, there's not as many DOs here as there is back in the East Coast. What is your guys' general kind of understanding, or what's your kind of your take on DO schools?
Probably a mixed opinion amongst us ourselves as there is the general public too. I mean, it seems like back in the day it was almost frowned upon, I mean, or looked down upon compared to MD, but it seems like, especially with the recent changes with residencies, how they're mixing, which I'd love to hear your opinion on that.
Yeah.
That it's pretty much, just the same, other than that the DOs receive a little bit more holistic and extra training in that. So.
Right, and I think that's the case. So I was very, now, I had gotten into a couple of DO schools. I still had interviews at MD schools. Utah told me I got in like in early December, so I just bagged everything and took that because it was cheap.
Yeah, it's awesome.
And I didn't go on any more interviews. I only went on 3 interviews, and I still had like 6 left or something like that. They told me early I was done. I didn't waste any more time. It was really frowned like oh, I don't know if you really want to go into DO school, right? I think most important thing, I think there are some DO schools that are better than a lot of MD schools. I know when you're looking at residents, so when we were looking at residents to take into pediatrics, really didn't make a difference. What they started looking at is your step scores. Your steps are the tests that you take when you're in your medical school. So you have step 1, step 2, step 3. That's what we looked at. More so than if they came from a DO school. These stupid scores, your MCAT is the most, like if you had to have one thing that you smoked, it would be your MCAT. Somebody that walks into a place with an MCAT of 40 something, they're gonna get in wherever they want, right?
Yeah.
They're gonna get in wherever they want. If you're really like pretty good at everything else, it's gonna be pretty competitive, but if you smoke the stupid MCAT, then that you're gonna get in. And mind you, there's nothing, I never use, I feel like I'm a scientist. I do a lot of experiments. I set up a lot of different tests. I never use inorganic chemistry. I never use organic chemistry. I never use physics. Never. The only time that you use it is like, you do blood gases and you look at, and some of the ions that are common in our bodies. That's about it. That's it. Something you could learn in an afternoon if you tried harder. But those tests are really, they're your readers. And then the same thing happens on your step 1, step 2, and step 3 in undergrad or in medical school. Those are very, very important. Please.
I kind of wondered why some of the medical schools do a pass-fail without a grading system. And as you said that, it made me think that's probably the motivation behind somebody saying, I'm not working for an A or B, I'm working for that step score. Is that kind of the thinking?
So there's three different types. There's types, and most of the DO schools will give A, B, C, Ds, and Fs. The MD schools, there's a lot of them that go to this pass-fail, but then you'll have a ranking still. So that's another thing to ask them. Some will still rank you. So you might just pass, but you're the 99th out of 100, and they'll put that on your dean's letter.
Nice.
Right? So it doesn't matter that you pass, you're still the last in your class kind of thing. Or, so you gotta see if they have ranking. So like Duke or in some of the Ivy Leagues are just pass-fail. And they do that because they're kind of pretentious and they think, oh, we're an Ivy League, you're gonna take everybody from us kind of thing. But then they have those schools, if they just have pass-fail and they don't have a ranking, then really all they care, all the people that are in residency are gonna be able to look at is, how did you do on your clerkship? So if you're going into surgery, did the surgery people that graded you give you honors? And how did you do on your boards? And that's it. Or your step 1, step 2, step 3. So you have to do all of those tests.
So, and then also kind of along, I guess, more for residency, but you hear a lot of people about, I guess there's often a debate between students doing research or going abroad during their first year summer. It seems like that's the common theme, that they either advertise going abroad and doing service or doing research that first summer. Which is more beneficial for for getting into certain resident, or does it kind of?
No, it's easy, it's research.
Service doesn't matter as much anymore, right?
No, it doesn't.
You're gonna be a doctor.
I'm being dead serious, it doesn't. So when they're looking at it, so when I'm looking at fellowship applicants now, right? Like, my first question, we have 7 questions that we evaluate each person. And I'm telling you, when you're doing there's one thing that I have to stress, if you take something out of this whole talk, whenever you're doing these interviews, you dress nice, you dress like very conservative, you wear a white shirt and tie. It's not the time to be unique. It's not the time to wear like a flying bow tie or something like that. It's something you just wear, you just look normal, dress normal, be very polite, be very courteous, say thank you to the secretaries, send the secretaries thank you notes for all they did for you. Every interviewee send a note to, send an emails, just say thank you very much, be very gracious, and try to come up with a reason why Creighton is where you want to be for the next 4 years, because where is Creighton? In Nebraska? Omaha? Yeah. Nebraska is, you know, where your great aunt lives, and I can't wait to be with her again because I love her so much, kind of thing. Like, Creighton is the end of the earth. That's why I'm applying to your school, because I cannot believe I get a chance to interview here. But I'll tell you, and I'm not, like me, I listen to the people, I have the interviews, but I sit in the committees of people that got interviewed, and they're like, yeah, he wore a bow tie to this. He wore a bow tie to his interview. He's out. And I'm being serious. It doesn't matter what he has. He's done. Or she didn't dress very. Didn't dress very well. Like wear low-cut shirts or something. They're out. I'm being dead serious. That's as subjective as it gets. And those people have complete control, right? They're looking for something to differentiate you. They're looking for a reason why not to select you. So they'll say, oh, he was snooping through my dresser. Like one guy went up to a lady's shelves and was like holding her awards that she had gotten. He's done. He's out. And that's just what it is, you know? So these old timers, they don't care. They're just looking for a reason not to take you. Being courteous and polite, and saying thank you to everybody, and coming up with ways of, one of the questions when they're filling out after the interviews, is Cincinnati a good fit for them? And they're looking for reasons why you would want to go to Cincinnati, or Omaha, or Indianapolis, or Columbus, or wherever it is. Now Utah, I think, is kind of pretentious though, because they have all of these interviewees. They have everybody that wants to go there. It's a good school, but they think they're the end all. And you know, if you don't get into Utah, that's okay. There's other great schools. My colleagues have gone to Northwestern and Ivy Leagues, and they've gone to DO schools in the middle of Arkansas or wherever, and it's okay, we're all the same when we get done. So it doesn't matter. You get in, look at the cost of it, make sure, if you're looking at Denver, think again, I wouldn't go there, it's $65,000 a year, and you're gonna walk away with $300,000 to $400,000 in debt.
So how would you say your exposure to the programs at the U influenced your decision to apply for certain residencies? And the reason I asked that is we heard from a physician here not too long ago that said prior to going to the U, he worked as a surg tech up here at K. He said he really enjoyed that. However, he said his exposure to the surgical program there, and some of those surgeons left him with a pretty bad taste in his mouth.
Right.
And he said, well, I don't want to be surgeon, this is what it's like. Well, he ended up going, primary care, that's
Right.
fine. But he said afterwards, maybe I would have gone surgery had I not had that experience.
I think that's a fair assessment. You kind of cling on to people that you want to be like, in some ways. The surgeons there are, I think that's a fair assessment.
So your experience there, did that help direct you to pediatrics at the time?
You know, I was just happy. I was happiest on pediatrics. I felt like it was a good fit for me. I really did. I thought, you know what, this is it. And my mentor was a pediatric intensive care physician. She was awesome. I thought, this lady's awesome. This is who I want to be like 10, 15 years from now. So I kind of gravitated towards her. I think there's pluses and minuses with each career. I have, as far as money goes, it just depends on where you end up. As a pediatric hematologist oncologist, I can make 2 or 3 times the amount I'm making at Cincinnati, but since I'm staying at the best cancer center in the the world for kids that they don't pay you as much. It's the same thing if you were like any of these professors could work in industry right now, right? And probably make 2 or 3 times the amount they make, but they stay here because this is where they want to be. So as far as finances, even primary care folks can make $250,000 a year. And there's radiation oncologists who are supposed to be at the top that make 125, or depending on where they're at. So it just depends on where you want to go.
So is there anything in medical school that you went in, and I don't know if you said that in your interview, you said I want to work in emergency medicine, and then if you don't, is it kind of like, well, you're not going towards what you told us?
No, so I went in, oh no, so I think I would very strongly advise towards is when you're doing your interviews, unless you've done something, for instance, I had a buddy who was a physical therapist before medical school. He was like, look, I've been doing PT, I know all the muscles and everything else, and I have been rehabilitating folks for a long time after surgery. I'd like to be the surgeon that does that, and I could use some of my PT skills to help him in the long run. And that's what he ended up doing. So he had a large base of knowledge about surgery. He had worked with a bunch of surgeons, he knew about it. But and I felt like I wanted to be an emergency medicine doc because I had volunteered there. But when I interviewed, I said, I'm thinking about emergency medicine, but I'm keeping the door open. So I think that's the best answer all the way through, because you change your mind. And you figure out what you want, and maybe you walk in and you're like, I want to be a family doc, but you walk out and you're like, I really want to be an ophthalmologist. You really don't know until you hit your 3rd year. And it kind of weeds you out too, right? So if somebody flunks, gets an F twice in a row in OChem, you probably won't be able to go to medical school, right? Unless you have some other way to fix it. Same thing happens there too. So if you don't do as well on your step 1, people will start kind of filtering themselves. Like, oh, maybe I should do family medicine because I didn't pass my step 1 or something, instead of something like plastic surgery.
Mm-hmm.
What made you decide to go into to stay on faculty as a professor at a med school, and what is your experience of the different types of curriculum that are coming out? I don't know if you know a lot about, like they have the systems based and things like that.
Yeah, so I've been on some of these, and I think it's all the same. I really, if you go through and you chunk it up, or if you don't chunk it up, if you put it in organs or if you put it in systems, that's fine. I think there's some advantages. I think the traditional way of education is old school. I think when you're looking at a place, you should look at who's more progressive and who's actually doing research in their own education. Some people are just grinding through the book, but then they have other places that are, look, we are publishing all the latest stuff on how to educate med students. I think that's pretty beneficial. The reason I stayed there, like I said, it's a big place, right? So I could go to, let's say I go to primaries, and I do transplant there. And the primaries, they probably do 40. So they do about 1/3 of what we do there. And there's 3 people, so 2 or 3 attending, so you're basically a clinical, you work clinical 80% of the time. And my lot right now is what I want to do is I want to take care of patients 20% of the time, but then learn from our hub of patients and come up with ways to kind of treat the population a lot better. So I figure if I can come up with some ways of preventing some of these transplant problems, if we can figure out how to decrease the line infections, decrease the amount of GVHD, decrease the amount of thrombotic microangiopathy, to decrease the complications from it, and then tell everybody about it, maybe then we can save hundreds of kids throughout the world, kind of thing. So I think if you stay at a big academic center, you have a responsibility to learn from your patients and then tell everybody about it, and that's why they give you dedicated time towards it.
For somebody that would like to pursue maybe a similar path as you, continue doing research as a physician, what would you recommend in order to gain the skills? I mean, they don't necessarily teach you everything you need to know about doing research in medical school, or
you just get it, trial and error. You get with a good mentor. Now that's another thing. People are going to be looking at research now. And I know how many opportunities are there to do research here? Not a ton, right? There's some, but not a ton, and there's definitely not enough for everybody. So if you get a summer chance to go up and get one of these summer internships or something like that, take it. If you're in medical school and you have the summer off to do research, I'd take it. The international stuff is awesome. And if you're like, dude, I really want to be an international person, you definitely can be. And there's positions all over. In fact, people have come into our fellowship and said, you know what, I want to be an international person. And we have a big international program in Kenya right now. So people are going to Kenya for 6 months and treating sickle cell disease. So that's definitely there. It's just, you'll kind of put yourself in a niche. But that's a great niche. I would love, if somebody said, you know what, you can do international stuff, I'd probably do it.
Good. Oh, go ahead.
So you kind of addressed some of the things when you're applying. What would you say are like maybe a list of the biggest don'ts for students in their application and applying to medical school?
Yeah, so there's a couple of things. One is your interview days. I think you just be very respectful. And you don't know, the secretaries that work for the people on the admissions committee, they have a voice. They really do. Every single one of them can say, man, that Jeff was a jerk, and they are done. So I would send notes to them and say thanks. I mean, they do put a lot of time. Each interview day is a lot of work. I've been on the other side trying to plan these silly days, and they're a lot of work. So saying thank you to everybody, dressing nice, smiling, coming up with ways of why Oklahoma is the greatest place in the world, things that you can talk about. If you have a lot of experience, if you've been a surgical tech for 5 years, you can go in and say, I want to be a surgeon, this is why. Have a good reason why. But if you don't know for sure, that's okay. And I really think, like I said, once you're in residency, no one knows that you're a DO. I would not negate them at all. I've got buddies who are in radiation oncology. The guy from here, we went to Peru with him years ago. And we did undergraduate together, and then I went to Utah, he went to Arizona, and I went to DO school, and now he's practicing in Salt Lake, radiation oncology up in Salt Lake. So it doesn't matter. And it's a little bit, sometimes people will put it as a fallback kind of program, but it doesn't necessarily need to be. You can do anything with it. Yeah.
So how the MCAT has changed, right, and they're having a little bit of an emphasis of the behavioral sciences. Have you seen any kind of a change as far as the way that you practice medicine, or just the physicians around you practice?
It's all the same.
Yeah.
It's just a weeder test.
Yeah.
That's all it is, man. That's it. It just, it's all the same. Even if you're studying, like, again, you forget all this stuff that you grind through, because you're going to be re-memorizing something new, and then when you get to residency, you're going to be re-memorizing something new. It's just a big, gigantic hurdle. But at the same time, it helps you study, right? Like when you get to medical school is much easier than undergraduate. And it's not that tough. Like, because you're not working, you're not doing all the volunteer crap that you're doing. You're not president of 16 clubs and organizing fill in the blank. You're not working as a radiation tech so you can get experience. You're just focusing on school. So you go to school, some of the schools, like University of Utah was 9 to 1, and then we'd study from 1 to 4, and then we'd go home 1 to 5. When it came time for tests, we'd study and take the test and head down to Las Vegas and do a weekend something. It was really a lot easier. But you forget all the undergraduate stuff, and then you start focusing on your medical school stuff. But the thing is you have to absorb a lot of information, so it helps you learn how to work, and then get ready for these standardized tests. So it's not a complete wash. The content isn't as important as your process of getting there.
What advice would you have for us entering medical school in regards to times? I think it was statistic, like 1 in 4, like 1 in 6 students has depression by 3rd year of med school. So what your advice on that? If you did see other students, you kind of feel like like everyone's getting it besides me at some point, I'm sure.
Sure.
And then the other side of also too is you didn't necessarily have like a wife and kids while in medical school, but could you give advice on somebody who does for those families that you did and how to be successful in that matter? So both those.
Yeah, I think what you have to do is you have to kind of budget. So I did have a friend named Larry. Larry was providing, his wife stayed home as a stay-at-home mom, and they had 2 kids. And he worked as a fireman, and paramedic throughout medical school, so his life was a nightmare. He would, and then I had other friends that just borrowed money, and they dug themselves into eternal debt. But I think there has to be a level of understanding, and then just try not to take work home with you. So when you go home, you're present. I think that's the most important thing. If you have to study, you stay at the school and study and grind it out. And then you go home and you're present with your family. I have to learn how, it's a balance you have throughout your entire life. So if I'm writing a paper and I gotta get a paper ready, and I'm trying to balance it right now, so I'll go home. Up until about 4 months ago, I'd go home and, I'd go home at a decent time, 5 o'clock every day, and I'd hang out with the kids till 6 or 7, and then I'd get my laptop and put it on my lap and turn on the TV and just type away. And even though I was there, I wasn't present with my family. So it's better to stay at work until 6:30, and then go home and be there, than go home early and just be halfway there. So you just got to find that. Put a line in it. And so if you have to stay at the hospital or the school until midnight to get your studying done, you do that. But just don't take it home. And some people say, I'm not studying on Sunday or whatever. I think that's stupid. I just go to the school, grind it out, start early, get it done with, and then you have the rest of your day. But just be present.
What do you think the effects of Obamacare and how do you see that affecting physicians, and what should we be watching out for, and what is it, what things are just kind of false and that we shouldn't maybe worry as much about?
It's gonna, well, I wish I could answer that better, and I should know it because I work on policy type stuff through the hospital. But I don't see it as much because I don't bill. And my wife, who's a general pediatrician in the community, she doesn't see a big difference either. And she works in 2 clinics. One's a free clinic that takes care of Medicaid and uninsured patients, and one's a fully insured regular clinic. And she hasn't seen a big difference either. I haven't really seen a big difference. I think our taxes are going to go up, but I have yet to see it, and I don't know. Just because I need to know more about it, but I haven't dug into it and figured it out.
So going back to your first year of med school, if you're able to reflect on that for a second, were there any of those things that were kind of aha moments that once you were there and saw the reality of it, you looked back and thought, oh wow, I focused too much on this in undergrad, or maybe I should have done this a little different in the years just previous to that?
Yeah, once you get into medical school, I take it pretty easy. Once you get in, like your last year, so let's say you're comfortable that you're getting in, but start taking it easy. Your last summer and spring before you start medical school. Go on trips. I went fishing up in Alaska, and I went on, I think, a cruise or something like that. But just take it easy. I tell you, man. And you think maybe I should take an advanced anatomy course and learn I mean, you'll know it, but you'll have to know it anyways. You're going to have to rememorize it, and it's going to be in more detail than you'll ever get here. But that's all you're going to be doing. So there's really nothing to get ready for it. But you'll get there, and you'll grind it through, and everybody has fun. And I think the best thing is just know that you're cool. Like, if once you start turning it into a competition, like I got to beat that guy, then you're going to be on an island. The best thing is early on, identify a group of people that are similar to you. Say, let's be study friends, and let's meet up and go through the test together and work together. You're going to learn better that way. You as a whole, pushing each other and helping each other, is going to be much better than you independent. If your personality is that you've got to be the number one in the class, then you're probably going to be on an island. But otherwise, riding right in the middle and that's what I did, and that's what people that got the exact same as me went into orthopedics and plastics and all these very competitive subspecialties, and we all did the same, all of us. All the same on the tests, all the same on our regular grades. We were right in the middle, but we worked together and we had fun.
Good advice there.
What else?
What's the best thing about being a pediatrician and then also in your fellowship, and also what's the worst thing about both of them?
I think in medicine as general, I think be very careful. Do you guys know how much medical school costs nowadays?
50,000. In states like 30-something thousand. Out of state is 50,000 to 60,000, depending on where you go.
Right. And who's got families here? Raise your hand if you've got a family. All right, so tag on 20,000 on top of that, 20 to 25,000. Let me just put it into perspective. So something to think about and really take consideration. If you're thinking maybe I'll go into family medicine or general internal medicine, or I want to work in X, think about the loan repayment through the underserved loan repayment thing. Think about military. So I'll just put it into perspective. Let's say that you borrow, let's say you go to Denver. Denver, 65,000 a year, and it's not cheap to live in Denver, so now you're out 85,000 bucks a year, right? Is that fair? Right. So all of a sudden you're out 350,000 bucks, right when you walk out the door. And interest rates are now going to be about 4% when you're done. So that's fine, it's all secure, and they're going to hold on to it through residency. But let's say you go into something like, pick something, emergency medicine. So you go into emergency medicine, let's say you get into a 4-year emergency medicine program. So after that 4 years is done, and through compounding interest, now you're out about 425. Now an emergency medicine doc, they do pretty well, right? Let's say you get a good contract, you're excited about it, you make 220,000 bucks a year. That 220,000 bucks a year is probably going to be a bring home of about 12,000. Crap loads of money, right? But you owe 3,500 in student loans for the next 30 years.
Per month, right?
Per month. So all of a sudden that's 8,000 bucks you just brought home. Or, you see where I'm going here? So all of a sudden a third of your money is gone. And if you said, hey, you know what? I've got a family, I'm going to do military, or I'm going to go to an underserved place, and you're still going to make real money during that time. You'll make 100, 200,000, you'll make the same salary, but your loans are paid for, you just got to grind through. It's a pretty good gig, and they give you $20,000, $25,000 on top of that as a stipend. So really consider it. It's not for everybody, but it's something to consider. Because that student loan debt, it's shackles. It is 100%. Both my wife and I have 200, we're at 400 between the two of us. We're paying $4,000 a month. And I went and looked at boats one time. I was down in Miami. I was in Miami, and I went to the yacht show, and I was pissed off about my student loans, and I was like, I found myself like an 80-foot yacht that I could buy instead of my student loans. It was awesome. Two bedrooms, 3 bathrooms, and a big living room and a TV. So really consider it. Like, and I'm not alone. Every single physician that has student loan debt feels the exact same way as I do. If they're rich or poor, everybody feels the same. Like, holy crap, I cannot believe how much I'm paying in student loans. Like, it's real. And who's got student loans here from Weber State? Probably half of you, some of you, right? Some of you have student loan debts here. Those continue to compound on. So what I'm doing is I'm using my research to try to get NIH loan repayment. So you can take your research and say, hey, I'm going to do research for the next couple of years. Here's my proposal. And then they give you 35,000 bucks a year for if you qualify for loan repayment. So you do it for 6 years, and then mine can be paid for.
That's awesome.
But still, it's pretty competitive. Only a third to half of the people get it. But I think I'll be able to get it. I hope so.
And then you'll get your yacht.
Yacht, yeah.
Or just not have credit card. Right. But the student, so when you're looking at, and here's another thing. Okay, so let's say you go down to Arizona, and Arizona's 30,000. Going back to Denver. Denver's a great school, but if it's twice as much, be careful. The last thing I have to say is be very careful of the schools. If you have to take another thing, be very careful of the schools in the Caribbean. When people are looking at schools, I think they're like, oh, I take an MD school, DO school is about the same when they're taking a residency. I think the Caribbean's about 14 steps below that. So be careful with those schools. Those schools take about 1,000 people. They charge 60 to 70,000 bucks a year. 1,000 people a year. They own the couple square miles around the medical school. You get out, they all owe 400,000, and they all have pretty high interest rates, and not all of them get residencies. So be careful with them.
What was the best thing, sorry, about?
Everything. Man, I love my job. I go to work each day, and I feel like I'm making a difference. right? I've got buddies who went into business, I have buddies who went into accounting, I have buddies that build houses, and they are trying to find meaning in their work every day. And it's starting to, they're just punching the clock, right? But medicine, it's who I am now. Like, it is, I'm a physician, I'm the doctor, I take care of these kids that have cancer, and it's great. And there's a big difference between a job and a profession. And a profession, you get identified as part of your profession, whereas a job is just come in, come out, get out of here kind of thing. And you make a difference. You save kids' lives, that's great, you know? There's nothing, I'm gonna work till I'm 80. I love my job. Every day I'm happy to go to work. So, I think that's the best thing. All right. Anything else, guys? I can stay around for another 5-10 minutes if anybody has questions, and yeah, thanks for hanging out.
Thank you.